Hey, I'm David Pope from Clinical Edge and the Physio Edge podcast. I'm an APA titled Sports and Musculoskeletal Physio, and today I want to have a chat to you about lateral elbow pain and give you 3 tips that are going to help you improve your results with lateral elbow pain. Lateral elbow pain, often called tennis elbow, lateral elbow tendinopathy, lateral epicondylalgia, it's got a bunch of names, but it can be one of those conditions that responds really quickly, but it can also take a long time to get your patients back to full recovery, back to all their work, sport, activities, and all the things they want to do. So we want to get them on the right path, and I want to share some tips with you that'll help you make really good progress with your patients. Some of the most common treatments that I see recommended for lateral elbow pain include resting, icing, some anti-inflammatories, and then often some stretches or some cross-fiber frictions on the actual tendon. And then sometimes people even include some stretches for the wrist extensors as well. So they're the most common things, but the trouble is they're often not effective. You can occasionally have a bit of natural recovery that makes you feel good about getting a result, but with those treatments, they're often not what's going to help your patient to get that load capacity back in their tendon and in their upper limb, so their ability to be able to do all the things that they want to do. And oftentimes they rest and then their pain comes back as soon as they start back up with all their activities. So what can you do about it? The first thing you want to do with your lateral elbow pain patients is make sure that you've got your diagnosis correct. So there's a bunch of different structures and different conditions that can cause pain around that lateral elbow. And we want to make sure that if you're treating it like it is, a lateral elbow tendinopathy, that you are on the right track. So the most common presentation with lateral elbow tendinopathy is that the person is over 30 years old. So if they're under 30, you're going to be suspecting that they probably don't have that. The next thing is that they're going to have pain with gripping as they come into elbow extension and pronation. So if they're reporting to you that that's their most painful position, gripping, picking things up with their elbow in extension and then into pronation, it's starting to fit that pattern of a lateral elbow tendinopathy. If they've got a different pattern, for instance, if they get pain as they're lifting the shopping up and they come up into elbow flexion, then you might be suspecting something else. We know that the humeroradial joint comes into a closed pack position at about 90 degrees flexion and 5 degrees of supination. So if they're getting pain up here into elbow flexion, you might be starting to suspect that that lateral elbow pain's got more to do with that humeroradial joint. And you're going to be targeting more around that elbow joint with your treatment rather than thinking you're just going to strengthen up those wrist extensors. So there's a little bit about the differential diagnosis. There's a ton of other conditions around there that can actually cause pain into the lateral elbow, but that's a bit of a start. You're looking for those aggravating activities that fit with the pattern associated with the lateral elbow tendinopathy. My second tip is to avoid things that are going to aggravate it. Now there's a couple that we know lead to worse outcomes, and those are, first off, cortisone. You don't want your patients to have cortisone because we know that at 12 months, they're going to have worse outcomes regardless of any other treatment with cortisone injection. So even if they do nothing, at 12 months, if they had cortisone compared to nothing, they'll be worse off. So avoid the cortisone like the plague. Now, our second thing that you want to avoid is the cross-fiber frictions of the tendon. So we really often want to get stuck in, or your patient's getting stuck into rubbing that tendon, but there's studies showing that that also leads to worse outcomes. So you're likely to irritate an already irritated structure, so avoid the cross-fiber frictions around that tendon. And finally, stretches. Often feels tight, feels like you want to get in there and give those wrist flexors a good stretch, but avoid the stretches. It can really irritate an already irritated structure. It can cause some compression at that lateral epicondyle where the tendon attaches and can cause some compression of that tendon. So avoid the stretches, you want to avoid the cortisone, and also avoid your cross-fiber frictions. Our third and final tip is to perform your exercises pain-free every second day. So we want to make sure that all your patients' exercises have no pain, and that could be fatigue pain or any other type of pain, their pain, avoid pain, and perform them every second day. So with a lot of areas in the body, there's been good research showing that going into pain or working with some level of pain works quite well. Around the lateral elbow, it doesn't work like that. So you're far better off around the lateral elbow, making sure that all the exercises are pain-free. And also, you can give your patients that day off. They perform their exercises one day, and that could be 1 to 3 to 5 sets. You can slowly build up of your exercises, but then give them that time to make sure they've recovered fully. Then we can rebuild their strength or work on improving their strength on that next day. So you might work on like a Monday, Wednesday, Friday routine, or something where they're getting that day off in between to recover. So there's your 3 tips on lateral elbow tendinopathy, lateral elbow pain. Hope that helps you get some better outcomes. If you would like to learn more about lateral elbow pain, we've got a full series of online courses on elbow pain, and that's over at clinicaledge.co. You can sign up for a free trial membership and you can get access to a full series of videos that are going to take you right through your treatment of lateral elbow pain, anterior and medial elbow pain. There's a whole lot of videos there. So if you enjoy this video, check out those ones and you get that with your free trial over at clinicaledge.co. See you on the next video.